Hey, I'm Dr. Kathy from Rainbow Kids Urgent Care, and I'll be talking about diarrhea. Now, we've all had it, right? But when it's our kids, it can be pretty concerning. So first, let's define diarrhea. Diarrhea is when your kiddo suddenly gets loose, watery, and frequent stools. By far, the most common cause is from the stomach flu, otherwise known as gastroenteritis. And since this is caused by a virus, oftentimes there's actually no medication to treat this. The most important thing that you need to do is to keep your child hydrated. Now you may ask, what are some things that I can do to make my child feel better? Does the brat diet help? The bananas, rice, applesauce, and toast diet, also known as the brat diet, actually is no longer recommended. It's low in fiber, it's low in protein, it's low in fat, and it's low in nutritious foods that are actually good for your gut. And in fact, other pediatricians think that it may make symptoms last longer. Ideally, children will be able to resume eating a good, balanced diet within about 2 to 3 days. But if your child has been vomiting, you may want to stop giving them solids for a few hours. If they start to feel hungry or even thirsty, you can offer foods that have lots of fluids in them, like soups or even popsicles. If that goes well, you can move on to bland carbohydrates like crackers, saltines. Those can help settle the stomach. Now, other questions that parents will ask is, do probiotics help? Now, probiotics are good bacteria that are found in our gut, and there's actually some evidence that they can help with diarrhea, but there's some studies that still need to be done. Now, if your child has mild diarrhea without vomiting, usually this only lasts a few days, and in fact, you may not even need to modify their diet. However, if you notice that when they're drinking milk, their tummy feels a little bloated, maybe nauseous, it may be worth talking to your pediatrician to see if it might be helpful to pull back on the milk a little bit. What about if your child has diarrhea and vomiting? Oftentimes these kids won't even want to eat. So your focus is really to keep them hydrated with things like electrolyte solutions, Pedialyte, even in the form of popsicles. These electrolyte solutions are actually mostly helpful when you give them often and in small amounts. Your goal is to get your child to pee at least 3 times in 24 hours or at least once in 6 to 8 hours. So how do we define severe diarrhea? Severe diarrhea is when your child is having a bowel movement every 1 to 2 hours or more than 10 episodes in 24 hours. This can lead to dehydration, and dehydration is when your body has lost too much fluid. So what are the signs of dehydration? Things that you should be looking out for. Dryness of the inside of the mouth. Significant decrease or even absence of urination. Drowsiness. Decreased or absent tears. These are all symptoms that should prompt you to take your child to be seen right away because they may need IV fluids. Now, what are other reasons that you may need to take your child to be seen? If they have a fever lasting more than 48 hours, if they're having blood in their stool, if the vomiting is blood-tinged, green, or even coffee ground, if they have severe stomach pain, or if their stomach is distended and severely tender, if they develop rash or jaundice, which is yellowing of the eyes. So what are some things that you should avoid? As an adult, you may be prompted to pick up Imodium because it may help you with your diarrhea. But in your child, it can actually be pretty harmful. Another thing that you should really try to avoid are sugary beverages because they can actually prolong the diarrhea. Typically, a child will have vomiting for about 1 to 2 days. The diarrhea may last about 10 days, but significantly improve at day 10. In a situation that your child is having loose, watery stool after 10 days, I strongly recommend that you see your pediatrician because they need to be investigated further. If you guys have any questions, don't hesitate to reach out to Rainbow Kids Urgent Care. Thanks for watching. Bye.